Hi, how are you? Real quick share. I got a message a little while ago from a friend client who takes an aromatase inhibitor. Now, if you don't know what that is, then you're lucky. But it's actually used in postmenopausal women who are recovering from breast cancer. Anyway, so she experiences tinnitus when she takes it. So, and interestingly enough, the oncologist says that can't possibly be that. She's never heard of this before. Nevertheless, that's the common experience that this woman has. And today, it was just unnerving, for lack of a better expression, to have that ringing in her ears. So she opted to use some sandalwood because she likes the smell. And she was just kind of wanting to feel a little bit more grounded in her body because she's changed the time of day that she took it, and she was just having a pretty bad reaction to it this morning. So she used the sandalwood, and the next thing she knew, within an hour or so, the ringing was worse, and she was having a full-on panic attack. I mean, like really, tight in the chest, feeling very, very anxious. So that's when she hit me up. And I immediately told her that she needed to go use some lavender. The reason why is because true lavender, has an influence on estrogen levels. So does sandalwood. Sandalwood has a constituent in it called santalol that acts kind of like an aromatase inhibitor. So what she did is she used a medication and an oil that had the same actions in the body. And you can look this up when you look at up tinnitus and estrogen, you'll see that researchers are finding that the fluctuations in the hormones, specifically estrogen, because estrogen is directly related or indirectly, it has an influence on our hearing, whether you knew that or not. So the fluctuations in estrogen actually contributed to an increase in tinnitus around women's monthly cycles, and especially after menopause. So, and it makes sense that this medication, which basically takes the only reason you can use it is if you've gone into menopause, and it's safe, because ultimately what it does is it bottoms out your estrogen levels. And so the combination of the sandalwood and the medication now created an interaction that amplified the effect of this hormonal fluctuation. Lavender, like I said, influences, acts like, I should say, sorry you guys, lavender actually acts like estrogen in the body. So if the aromatase inhibitor is actually blocking the use of estrogen, then the lavender is acting like estrogen. And now you may think that sounds counterintuitive, but what we wanted to do is to increase, just on a small level, the estrogen levels or the estrogen activity, so that we could eliminate or diminish the symptoms. So again, lavender does not take the place of estrogen in the sense of it's not estrogen-like. And how do I say this, if it makes any sense? So whatever I say here, I want to make sure that I invite you to comment. Feel free to comment with questions. Every time I talk, I deliver these messages. I'm putting a pause on what I'm sharing, because I want to make sure that I convey that I'm very, very passionate about what I do. And I really am here for you. So if there's something that I say that doesn't make sense and you would like a little more clarification on, given the fact that this is all virtual at this point, and we know the climate, the public climate, and when it's not necessarily always favorable when it comes to online conversations. So if there's something that you're questioning, or you're doubting, or you're unsure of, and you would like an answer to, by all means, message me directly, and I'm more than happy to answer you. Because, like, again, I've devoted almost 30 years of my life to studying this. So if it's not hitting you with what I'm sharing isn't making sense, then please ask for what you need, because I'm here for you. So with that said, lavender And so thank you for that. Thank you for trusting me, because really I am a safe place for you. There's no judgment here. This is just me giving to you. And with that said, again, lavender, there's some questions around different oils, and some oils actually stimulate the production of a neurohormone, okay? In the case of lavender, I've talked about this a lot. It doesn't stimulate the production of estrogen. It acts like estrogen. So it's a big difference. It means the shape of the molecule is very similar to that of estrogen. So therefore, it can act like estrogen and create and modify estrogen activity in the system. This is the reason why we want to be careful with overusing lavender, true lavender. But in this case, with this woman, and I'm going to suggest that she actually stick with it, especially since she is using an aromatase inhibitor, not a lot. She doesn't want to use a lot, and maybe just a couple of times a week, because we don't want to, the medication's already doing something. We don't want to set her backwards, okay? But, you know, like I said, 2 days a week, no more sandalwood, she'll be fine. And she knows, obviously, to stay in touch with me if anything comes up around that. But there again, using true lavender on a regular basis does act like estrogen, and with the number of phytoestrogens that are in our foods, and xenoestrogens, which come from the environment as far as chemicals are concerned, and I'm going to look something up for you while I'm here. I wrote it down because I'm actually reaching out to this gentleman. And it just dawned on me, so please bear with me here. The book is called Sicker, Fatter, Poorer. And it was written by a gentleman by the name of Leonardo Tresande, I think is how you say his name. But it's Sicker, Fatter, Poorer. And it's based on his research with regards to the endocrine disrupting chemicals on the planet. So that's the reason why I say use a little caution around lavender. Always use caution around lavender, even with the person who's postmenopausal, only wants to use it a couple of days a week because of the other estrogen-like chemicals that we are being surrounded with. So on that note, like I said, it's actually saves the day for her, because she was able to get over that anxiety attack. The tinnitus lessened quite a bit, and she said that she noticed it within about 15 to 20 minutes, that everything started to de-escalate. So yeah, and by the way, just for reference, they are looking into treating women who experience hormonally related tinnitus, because there's different factors with regards to, and I could get into it a little bit deeper at another time, but there are other factors that they're looking at that are related to tinnitus. It is equal to nerve pain. At the same time, because they've identified it to fluctuate around the women's cycles, they are looking to treat it with low doses of hormone therapy. So using lavender as a counter to the sandalwood worked, because the sandalwood didn't relax her. It actually caused the exact opposite reaction. So that's what when I talk about adverse reactions, that's what I'm talking about. So, and it's because she was duplicating the mechanism of action, meaning she took a medication and then she used an oil that had the same activity in the system. So this is why I always reference, customized work, because we just never know. We just never know how our body's going to react, especially when there's so many other chemicals involved. So anyway, hi Doug, it's good to see you. So that's why I say lavender saved the day, because it actually countered the actions of the medication and the sandalwood, which had her in a full-blown anxiety attack. So, and who would have thought sandalwood would have done that, right? Anyway, I'm off for now. Thanks for tuning in. I don't know, is that, I can't see I don't have my glasses on. Anyway, I appreciate you being here, and take care.